Gynecomastia is a relatively common condition that affects about 60% of males. The condition is known as benign breast enlargement. There are some obese patients that I do see that would rather attempt to lose weight rather than surgery. And I certainly see these patients over the course of many months. And if they do lose the weight, the gynecomastia remains. And the reason the gynecomastia remains is because gynecomastia is not just a fatty male breast. There's some contribution of fat to the male breast, but in most instances it's a very dense fibrotic mass that's underneath the areola. Thus, it's not really amenable to weight loss. Surgery is the best way to take care of that very dense fibrotic mass that's palpable underneath the areola. The causes of gynecomastia include obesity, drugs, certain kidney disorders, liver disorders, diabetes, alcoholism, but in most instances it's just due to hereditary, meaning the genes cause it. Your family has a history of gynecomastia, and so you have it. I know it can be very difficult for a male to come into a cosmetic plastic surgeon's office, shed their clothes, and show their enlarged breasts. It lends itself to a very anxious consultation. I see the patient myself. There are no nurses in the room, so it's me and my patient only. We discuss what gynecomastia is, we discuss the causes of gynecomastia, and we discuss the treatment options. Once a decision is made for surgery, the process is fairly straightforward. The patient decides on a particular date and time of surgery. The surgery is performed in an outpatient surgical center. It's performed under general anesthesia so that the patient doesn't feel any pain and is unaware that the surgery is completed. Once completed, patients go home same day after surgery, and the surgery takes about 2 hours. Most patients ask, how long will it take for me to see the results? And I tell all my patients the results are near immediate. At 1 week, you may have slight bruising and slight swelling, but within 3 weeks, that bruising and swelling has diminished, and you can go out without a shirt for the first time, probably in many, many years, and be excited about the way you look. Gynecomastia patients are some of my most happiest patients. I truly enjoy working with them because the surgery is relatively simple with minimal complications, and it can change a man's life forever.